going to cover the consequences of poor posture. Before we get into it, let me introduce myself. My name is Joey Dussel, and I'm a trainer at Nike World Headquarters in Beaverton, Oregon. Today, we're going to cover a little bit of anatomy knowledge and terminology so that you'll understand what we're talking about as we cover the consequences of poor posture. Before the end of the video, I also want to show you a couple of strategies that you can adopt and introduce today to start negating the consequences of poor posture. All right, let's get into it. The physical symptoms of poor posture, of course, include pain and discomfort, usually centered in the low back or the front of the hips, sometimes both. Additionally, you'll feel it in the shoulders, an aching sensation in the upper back, sometimes a painful sensation on the front of the shoulders, as well as right at the back of the head, right at the hairline, and along the back of the neck. Finally, numbness and tingling, sensations of a cold arm can also be symptoms of poor posture, consequences of poor posture. But as we cover our video content today, we'll talk about not only what you'll feel, but what's actually going on in those tissues and what you can do to make a difference for them. As we go through this video, you'll hear me talk about the consequences of poor posture and, more importantly, the affected tissues and the structural changes that they go through as they're affected by poor posture. So the spine and its vertebral segments do suffer degradation from slouched posture or hyperextended posture. And what that means is that physically the bones will be placed in a position that causes them to, over time, change their shape and their layout. It's subtle, but it is your body's adaptation to the forces that are placed on our body. Unfortunately, this system is not built for slouched position, and so when the bones adapt and they change their structure a little bit, it causes a host of other problems. Usually, initially, the first consequence of poor posture when it comes to the spine is with the discs. Instead of having a nice segment above and below, the discs, once we're in a slouched position, are subjected to this unequal force where the slanting of the spine is causing a pinch on one side and a pressure on the back side. And this actually can cause the disc to bulge out the back and unfortunately injure the nerves that surround the vertebral column. So you can have damage to your bones and you can also have damage to your discs. Now additionally, there can be damage to the muscle structures. Typically when a muscle is asked for constant tension or continuous tension throughout the day, it becomes stiff as an adaptation. That can have a downstream effect into the joints and actually cause premature joint wear and tear because of muscular strength or tension imbalances. And then finally, the last consequence of poor posture is related to tingling and numbness. So if we have postural positions that are suboptimal for the low back or for the neck particularly, we can often find symptoms of numbness or tingling going down the arms or going down the legs because there's pressure placed against the nerve, and that nerve is causing those sensations. Just like when you hit your elbow, sometimes called the funny bone, you feel that sensation down in your hand. Well, there's nothing physically wrong or different with your hand. It's that you've had an impact to the nerve, and that's how your brain is perceiving that impact. So same thing if we have the low back with a bulging disc pressing against a nerve can cause nerve pain that goes down the leg. And it's not a problem with the leg, it's a problem with the spine itself and the nerves going along the spine. Now for the rest of the video, we're going to talk about affected tissues, how those muscles and joints are affected by poor posture, and then what you can do about it. Okay, the first thing you need to know when it comes to consequences of poor posture are some anatomy terms and concepts so you'll understand what we're talking about as we go through the rest of this video. Now the first thing that you need to know is a couple of anatomy terms. Don't worry, it's not going to get super complicated because I'm not here to try to impress you with how much I know. I want to make this accessible and something that you can really get a hook on and start to implement in your life right away. So, anatomy terms that you need to know, starting off with the spine. If I stand sideways so that you can see this, the first position is going to be neutral. That's standing straight up. The second position, the second anatomical term, is what we call flexion. That means that your spine is curved forward. Finally, extension is when your spine is curved the other direction. It forms a shape that is basically like a parenthesis, half one way compared to the flexion that we saw earlier. So this position is called extended, this position is called flexed. As we go through today's video, you'll see how forces are placed on the spine, and most importantly those discs and the important nerves that run down the length of the spine as we go through these positions of flexion and extension. Now continuing up, when we get into the shoulders, we introduce rotation. The two major components of the shoulder are internal and external rotation. When we're typing in a computer or when we're texting or driving, we usually are in internal rotation. From the front, that just means that your hands are turned inward or downward. External rotation is the opposite. That's when your palms are turned the other way. And it's not just about the hand and the arm, but also what's happening at the shoulder joint. So external rotation goes this way, internal rotation goes the other way. Now, as you can probably see there, when I internally rotate, it also caused the shoulder to shift position, to elevate a little bit. This is a common compensation, and we see it frequently, that elevation starts to compensate when we lack ideal or adequate normal rotation in the shoulders. Continuing up into the neck, we still have the ideas of flexion and extension, just as we did with the spine, but now of course we also have rotation. Now the different phases of the spine have different capacities. You can think about the low back, the mid back, and then the neck. Those three segments have different focuses, different things that they're good at. The low back is built for stability. The mid back is where we have the rib cage and then the shoulders really attached to. And then finally we have the neck, and the neck is built for mobility. Unfortunately, this gets a little bit twisted for many people, and their low back, a structure that should be stable, is now attempting to be mobile. This is to compensate for lack of mobility in other parts of the body, poor posture being one of those key contributors to lack of mobility. So, in the low back, in the mid back, in the neck, we have a desire for stability and we have a desire for mobility. We want to make sure we cultivate both sides of those and don't go too hard to either stability, that would be tightness when it's taken too far, or to mobility, which would be looseness when it's taken too far. Now, the last thing that I want to cover for anatomy has to do with your diaphragm. Most people have probably heard of this before, or they've had a sensation of a stitch in the side where they have that pain or that cramping sensation in this muscle. It's a very thin muscle, almost like the bottom layer of your lungs, and when it contracts, it creates a vacuum that draws atmosphere and air into your lungs so that your lungs can transfer that to your blood and provide it to your body. Most people do most of their breathing, particularly when they're under challenge of a workout, through their upper back and their shoulders here. So it's this rib cage, this expansion or a lifting up. You've probably seen people when they're really tired and they're heaving like this up and down. Unfortunately, this is a very inefficient breathing pattern because we don't have much volume expanse when we change the rib shape, and it does not tap into the vacuum that is created by the diaphragm. So rather than breathing high to the chest, rather than having the expansion, we want to utilize the diaphragm and breathe low to the belly so we're drawing in more oxygen with each breath. Additionally, the hips suffer the consequences of poor posture, mostly due to our sitting nature. The 21st century lifestyle gives us a lot of time when we're sitting at work, sitting in the commute, and then sitting in leisure when we're watching our shows or when we're even spending time with our family at the dinner table. Sitting happens a lot. Unfortunately, it's your hips and by proxy the low back that take the brunt of this sitting nature. A couple of things for you to know about the anatomy is, number one, the anatomy of a very common enemy in the hips. That's the psoas. It's a muscle that goes from the front of your thighs up and across to your low back. When this muscle is contracted or when it shortens, it's either going to tip your trunk downward or it's going to lift your thigh upward. When the psoas becomes stiff, when it becomes chronically tight, it's a major contributor to back pain. Okay, let's dig into the consequences now. So the first consequence, and most notable, is rounded posture in the shoulders. This is what happens when we become tired, when our muscles are fatigued from holding us up in a nice vertical position, and they start to slump forward. Now there's really two things going on with rounded shoulder position. Number one is actually in your spine, and number two is with your shoulders. So let's talk about the spine first. When we've introduced this rounded shoulder position, we've deviated from that nice neutral and organized spine. Remember, neutral and organized is where you're strong and safe. Not only is it going to feel better during your daily life, but it's also going to perform better and give you a little bit more power and capacity when you're in your exercise sessions, whatever they may be. So, if we're in this position and we've lost our spinal curve, and then we've additionally lost our shoulder position, there's two major things we have to worry about. Number one is with the spine, and that's with the discs. Your discs are stacked up on top of each other like this. An easy way to visualize it is a stack of Oreo cookies. You have the cookies with the filling in between. If you stacked several cookies in a row, you would have an idea that's similar to the discs and the bones of the vertebrae of your low back. Importantly, along that structure is running the nerves of all of your nervous system. So all the signaling that comes from your brain and makes its way down into your lower body to produce movement, and then also receive signal back so you can sense the world, that's all encased in the spine. Surrounded by bony vertebrae, heavily protected, but always exposed to our poor position. So if you're in a slouched position, if you've lost your spinal curve, that stack of Oreo cookies is no longer a nice vertical column. Now it's starting to create a little bit of a curve side to side. Let me show you what it looks like. This pool noodle can be a helpful representation of the spine. So just like this, if this was placed against my back, touching my spine, your spine is going to have the same column shape. When we go into flexion or a round back position, the spine begins to curve like this. And when this happens, it puts a lot of pressure against the vertebrae along the back side. Also, it creates a pinching along each vertebrae on the front. You can think about how those Oreo cookies would start to be at an angle with each other, and this would actually cause increased pressure on the front side and a spreading force across the back. And that spreading force is where we get into trouble because your discs are able to press out backwards. When that happens, they push against the nerves, and that's what causes most of the problems that people suffer from when they have a rounded back position. Okay? So once again, that was our flexion. That's our forward slump. We'll continue on with the shoulders, but I want to talk about what happens if you're in the opposite position from that dangerous flexion. So if this is our flexed spine where we're curved forward, an overextended, or sometimes called extended spine, is going to be the opposite direction. Now this is generally what fitness professionals actually recommend when they're advocating for loaded movements like squats or deadlifts. We talk about making sure that our spine is protected, and we do that by tightening up the muscles that run along the backside, locking in each one of those vertebral segments so that they cannot move, and that protects the nervous system that's running along through those segments. Unfortunately, what we need to accomplish is not flexion, that's dangerous, or hyperextension, that's also dangerous. We want to be neutral, right in the middle. That means that all your vertebrae are stacked right on top of each other. Okay, so we know that it's not safe for the discs and the nerves if your low back is curved too much forward or if it's too extended. Both of these are common positions. Usually, we're curved forward too much as we become fatigued, and then we're overextended once those secondary muscles are trying to fill the role of stabilizing the body. So it really is a problem of trying to keep it out of the ditch on the left-hand side of the road and out of the ditch on the right-hand side of the road. You have to make sure that you're not too curved or too extended. Now let's move on and talk about what happens with the shoulder when we're in this rounded position. As soon as we go into this forward posture, when we become tired in the back, the shoulders, which are actually two parts, one, the upper arm, and two, this triangle of bone on the backside, both of those become exposed as we're in that forward position. So if my shoulders are forward, that triangle of bone has shifted outward and usually rotated a little bit, and the center of the shoulder, where the upper arm bone is connected to that triangle of bone, that has also shifted forward. Most commonly, we get this intense pain across the front of the shoulder, especially if you're an individual that still engages in physical activity. So if you're working and you're feeling these muscles and you're getting this pain right on the front, it's very common that that's actually because of the posture and what's going on the backside here. Now we're going to continue working our way up, and I want to talk about the neck. What goes on with our neck when we're in poor posture? The number one thing is actually the weight of your head. Your head is supposed to be stacked directly above the spine so that the weight is supported and stacked up pretty nicely. As soon as your head starts to travel forward of your spine, it becomes progressively more heavy because of the leverage that it has. So if your body is nice and straight, the head weighs about 12 pounds. As soon as the head starts to creep forward, it becomes heavier and heavier, and that puts a tremendous amount of strain on the muscles along the backside of your neck. These muscles, the number one culprit is called upper trapezius, or the traps. It's this triangle that goes onto each side on the back of the neck. Those muscles, when they're chronically worked because of poor posture, they become kind of like the only show in town. And that means that when you start to create other movements, those muscles try to contribute and over-contribute, and that can lead to a host of additional problems. So the posture leads to the muscle imbalance, and the muscle imbalance messes with our movement pattern, which can cause another injury down the line. So when we are in this forward position, when our shoulders are forward, the upper traps start to bear the weight of the entire head, even in that over-leveraged position. And the muscles across the front side of the neck are inhibited. This means that they're basically not able to contract as often, as tightly, or as consistently as they should. When they are no longer being used, they quickly start to atrophy. That means that they become weaker and smaller. When they become weaker and smaller, they're less useful for your body, and your brain will actually start to recruit them less and less often. If you use these muscles less often, they become weaker. And when they become weaker, then they're not as useful, so your body will not use them as often, perpetuating the cycle. So if we think about the consequences, so far we've covered the hips, the low back, the shoulders, and how they interact on the front and back, and then finally the neck. The last piece is the diaphragm. I think the diaphragm is actually the most important part of this entire video. So if you can only take one thing away from today, consider making it this. The diaphragm and your ability to breathe well is the most important of everything. Your ability to breathe is going to dictate your ability to do those other tasks. Just like in the airplane, if the air masks deploy from the ceiling, you should put your own mask on before you help others. Working on your own breathing, making sure you have adequate and plentiful oxygen matters immensely. You'll feel it for sure if you're engaging in physical activity and sport, but it also matters if you're in meetings, if you're getting ready to present, or if you're just working at a desk all day. So take care of yourself, make sure you get adequate breathing throughout the entire day, and make sure that your poor posture is not hamstringing your ability to breathe well. So if we go into this round back position, what we've done is we've basically compressed down a little bit on the space that can inflate in order to draw in that breath. The diaphragm is in a position where it can't work as well, and it's never going to be able to let us get that full breath of oxygen. So if we think about the consequences, the hips, the low back, the upper back and shoulders, the neck, and how that all affects our breathing, poor posture is a serious, serious detriment to be comfortable and safe while you're doing it. Now, we've talked enough about the anatomy and the consequences. Let's cover what you can actually do about it. The first and most important thing that you can do in order to protect your posture while you're doing activities of daily living or sport is to make sure that you brace your body effectively. The main muscles involved in bracing are your core. And before you think that you know what I mean, I just want to be clear. When we talk about the core musculature, we're talking about all the muscles that go from your collarbones to your kneecaps in the front and along the back side of your body. These are all the muscles that stabilize the trunk or which act across a joint that is connected to the trunk. That's your hips and your shoulders. So core muscles are not just the six-pack, and it's not just the low back. It's actually the chest, the shoulders, the arms, everything that crosses the front of the hip and the back, so the quads and the hamstrings. This is a lot of muscles. This is really a lot to think about, but it all comes together in a perfect system in order to protect the precious spinal column and those nerves running along it. When we talk about bracing, the first thing we want to do is set our pelvis. That means that we're just going to take the hips and find that neutral position, not tipped forward and not tipped backwards. Once we've achieved that neutral position, we want to lock it in by clenching through the glutes. When we're in that locked in position, we're using the glutes to stabilize the pelvis, which is the foundation for the entire spine. From there, working our way upward, we don't want the spine to be overextended or flexed, so find that neutral position right in between, and then make sure that your shoulder blades are pulled back slightly, pulling the elbows to the side of the body. Here's what that looks like. Rather than having them at all in front of the body, they should be lined up right with the side of the body and pulled back a little bit in between the shoulder blades here. Now, an important note, when you pull your shoulder blades together, we don't want to have them elevate or lift upward at all. And we're not asking you to stand like some kind of superhero as you go through your day. We just want to make sure that we're not in that forward position. So, just like with our earlier talk, not in the ditch back here or in the ditch out here, but in between the two. Now you'll notice that as we're fixing things from the bottom up, it gets easier and easier. So the pelvis being in the right place makes it a heck of a lot easier to find the neutral spine, which makes it easier to achieve those shoulders, and then finally to keep the neck directly on top of the whole system. So as we've done our glutes on our pelvis, now we have our abs and our low back. We're pulling the shoulder blades together, but not too much, and we're putting that head directly above the shoulder. So if you look at my ear, you can see that it's above the top of my sleeve. We don't want that head to be traveling forward at all. Now, an easy way that you can practice this is with the pool noodle. If I take this and I put it right down the back of my shirt, it should touch my low back, my mid back, and the back of my head. This is going to be our postural position right here. You might find that this feels way too far back at first, but keep in mind this is a little bit of a hypercompensation to get you as far away from that forward flex position as we can. If you want to, use something like a pool noodle or a broomstick to find that aligned position and then practice that throughout your day. Now, part 2 of bracing is to go through that pattern of glutes, abs, shoulders, and neck position while also being able to breathe. And that doesn't sound like much, but when you practice it, you'll find that this is actually surprisingly difficult if you've never done it before. So you can do this standing up or laying down if you need to. That's a little easier to start. But think about the bracing, the glutes, the abs, making sure that you have the shoulders and the neck right above the spine. And from here, start to diaphragmatically breathe, really breathing in low to your belly, making sure that there's no rise or lift or expansion in your chest, and it's only coming from your belly, going inward and outward. Like I said, you might find this is significantly challenging the first time you do it because that is a muscle that you need to train. It's something that you need to develop, just like if you'd never worked your bicep ever, it's going to be real challenging to start lifting those weights. Same thing with the diaphragm. You want to develop your ability to breathe using that muscle. All right, here's a demonstration of bracing, starting with setting the pelvis and then working our way upward through the spine, shoulders, and neck. I'm going to tuck my shirt in to make this a little easier to see. And I have my shorts here set just at the waistband, so this will represent the pelvis. If you're watching from the side like this, if we were in an overextended position with the spine, it would look like this shape. At the other side, flexion, when we're losing that rounded position, gives us here, this shape. And what we want is to be right in between the two. So with the pelvis, this band of blue, we want that to just be parallel to the ground. A lot of people will stand like this, usually with their knees locked. Unfortunately, this is just degrading to the low back and those vertebral segments. So a little bend in the knees, tension through the glutes to set the pelvis. And from there, we can work that neutral spine. Come up to the shoulders, which are just sitting at their full length, but remember with elbows to the side. And then finally, standing up nice and straight with the neck as well. So here, we can focus on bracing. I have tone in my abs, I have tone in my glutes. Those are holding me in the proper position. Now we're not squeezing those at maximum tension. We just want about 30% of their squeeze strength. So when you're standing in line at the bank, or if you're doing the dishes, or if you're working at your stand-up desk, you should have this organization. These should both be braced. To escalate this, we go into breathing and bracing while you're in movement. So eventually we want to be able to do this bracing while we're also diaphragmatically breathing in and out through the belly, and create this bracing when we're starting to create movements like running, jumping, squatting, jump rope. Anything and everything should maintain this tension on the front and back, even when you're moving or going through any exercise. Breathing and bracing is a lot more challenging than it seems like. You'll find that it can really be something, a skill that you need to develop. The final portion of bracing and breathing is to start to introduce movement. What we would like to see ideally is that you are able to brace your glutes, your abs, and keep your posture as we've talked about, and then also do it while in a running stance or doing a jump rope, or if you're doing yoga or scooping your kids up off the ground. All of these ideally should be moments where you're braced, your posture is true, and you're still collecting that oxygen. You're still keeping the nice diaphragmatic breathing. Now it comes with practice, and I will say that it's easier to start practicing laying down in the ground. Lay down flat on your back with your feet flat on the floor and work on breathing low to the belly. You can even put something small onto your stomach so you have a little bit of resistance to breathe against by expanding that belly upward. Once you've gotten better at laying on the floor and breathing well, flip over onto your chest and stomach and you'll feel the resistance of the ground. Use that as something to push against as you continue to work on bracing and breathing. These are still without any movement, so we always want to build up to the point where you can maintain that braced position and perform a squat or a bicep curl or an overhead press or any position that you need to accomplish. Breathing, bracing, and then movement. All right, thank you for watching today. Hopefully you learned something. We covered the anatomy so that you'd know what we're talking about, and hopefully you remember some of those terms. Then we talked about the actual consequences of poor posture, the hips, the low back, the shoulders, the neck, and how it affects our breathing. Finally, the bracing, how we can make sure to do that while we maintain our breath, and then finally introducing that into movement so we can start to be braced and breathe well and then move and go throughout our day. If you have additional questions, don't hesitate to reach out to me. Even if you feel like it's simple or maybe I've answered it 1,000 times, don't hesitate to send me those questions so that we can get you moving as well and as effectively and safely as possible. All right, thank you for attending. Hope to see you around. Talk to you later.